Hello doctors. Thinking about taking the Australian Medical Council exam? Well, whether you are a doctor wanting to practice in Australia or an international medical graduate exploring your career options, the AMC exam is your golden ticket to secure a job in Australia's world-class healthcare system. But let's be honest, prepping for it can feel real overwhelming, but don't worry, Academically's got you covered. Today, we'll be exploring how to prepare for the AMC exam, so stay motivated and most importantly, pass this exam with flying colors. So, if you are serious about working in Australia as a doctor, make sure you stick around for an exciting opportunity to get an expert guidance from Dr. Akram through his MedConnect tour. Trust me, this could be the game changer you need for your journey. You can read the description to know more about our career guidance events. Okay, so now let's break down the exam. So the AMC exam has two parts, the AMC MCQs and the AMC Clinical Exam. Now first, let's look at the AMC MCQs part. So this is a computer-based multiple choice question exam with 150 questions. It is designed to test your medical knowledge and a clinical reasoning across multiple specialties. Now coming to the AMC clinical exam. If you pass the MCQ, you will face the clinical exam which evaluates your practical skills. It's basically a series of patient consultation where you will be asked to assess, diagnose and manage different cases. Now, preparation for both requires different strategies and we'll get to that as well. But before that, let's talk about the resources you need to study. You don't want to drown in irrelevant materials, right? So stick to the trusted sources like number 1, AMC handbooks. These are straight from the exam creators, so they are a must read. Number 2, online platforms. Websites like Academically, where we provide tailored guidance and study materials, help you a lot in your preparation. Number 3, past papers and mock tests. Nothing prepares you better than practicing real exam style questions. Now, don't just read passively. Make sure you're actively engaging with the study material, such as taking notes, highlighting key points and practicing time management. And also, not all topics are created equally. Focus on high-yield topics that show up frequently on exams such as general medicine, pediatrics, surgery, psychiatry, and obstetrics and gynecology. And also remember, the AMC exam loves testing clinical reasoning, so don't just memorize. Understand why you are making a diagnosis or choosing a particular treatment. And also a quick tip here, always think about how you would manage a patient in real life scenarios, and that's what the exam is really testing, your ability to think like a doctor. Consistency is your best friend here. Cramming the AMC exam will only lead to burnout. Instead, build a solid study schedule that balances your time between reviewing theory, taking mock tests, and staying up to date with current medical guidelines. Don't forget to take breaks because you can study smarter, not harder, and also you're not a robot after all. Now, once you clear the MCQs, it's time for the clinical exam. And let me tell you, this one is all about hands-on practice. Find a study group or use a clinical simulation platforms to get used to handling different patient scenarios. You want to simulate the real thing as much as possible, including your bedside manners. Confidence in clinical skills can be the difference between passing and failing. Make sure you practice in a timed settings. Also, don't hesitate to reach out for expert guidance as well. And yeah, so that's your blueprint to acing the AMC exam. Start with a clear understanding of the format, gather your resources, and stay consistent with your study plan. And don't forget, if you need a tailored support, Academically has all the tools and guidance you need.